Kinders tussen 12 en 17 kan van vandag af ingeënt word teen COVID-19. Dit is 'n omstrede besluit wat kom nadat Suid-Afrika die 20 miljoen kerf vir inentings oorgesteek het. Ek gesels nou met Prof Shabir Madhi, entstofkundige van Wits. Professor, it's wonderful to have you on the show. Welcome.
Hi, good evening. Thank you for having me.
Do you support the government's decision to vaccinate 12 to 17-year-olds?
So I think 12 to 17-year-old children, and in fact children even above the age of 5, probably need to be vaccinated at some stage. But certainly in a country such as South Africa at this point in time, that is not a priority group, and particularly not when using a single dose of vaccine, which itself is going to provide very little protection against infection and mild COVID-19. The main reason that you're going to be vaccinating children is to try to protect them against infection and mild COVID rather than to protect them against hospitalization. Because the chances of a child who's otherwise healthy in that age group of 12 to 17 being hospitalized is extremely low unless you've got an underlying medical condition. In South Africa, what we should rather be focusing on is ensuring that we get at least 85 to 90% of people above the age of 50 vaccinated, because that is really going to determine what happens when we experience another wave, another resurgence, probably around about December. In addition to which, the vaccines that is currently being earmarked for children between 12 and 17 years, that vaccine could be much better used by offering a third dose of vaccine to people above the age of 65, as well as people with other conditions such as cancer or renal conditions or any condition that suppresses the immune system, because it appears that 2 doses of vaccine in that demographic is not providing the ideal amount of protection. So we need to be much wiser with the resources that we've got available, including the vaccines that we've got available. Eventually, I myself would get my children vaccinated, but there's really no urgency for children to be vaccinated at this point in time in South Africa, when only about 55% of people above the age of 50 have been vaccinated.
Professor, but surely government argues that the older categories have shown a decreasing appetite for COVID vaccinations, and they're sitting with a stock that we've paid for, Pfizer and Johnson & Johnson, that we must use. And that's why these age brackets have been creeping lower and lower and lower, much faster than we anticipated, right?
Correct. And I think that's the main reason for going to a lower age group, is because government is afraid that vaccine that is available might well expire if it isn't used immediately. But again, it speaks to the issue as to what is the priority. And for me, the priority is to ensure that those people above the age of 50, 55, that they've already received 2 doses of vaccine, that they actually receive a third dose of vaccine, rather than almost wasting this vaccine currently in children between 12 and 17 years of age. The main goal of vaccination in a country such as South Africa is not to try to get rid of the virus, which is never going to happen. The immediate goal is to protect against hospitalization and death. So yes, there might be some surplus vaccine available because of not enough people above the age of 50 coming forward to be vaccinated. But those that have chosen to be vaccinated, if they're above the age of 65, if they've got medical conditions, which requires them to get a third dose, it's a better utilization of those vaccines to target that group rather than use it in children between 12 and 17 years of age.
Professor, so giving children a single dose of Pfizer will not help really to free up hospital beds. I mean, that's not going to reduce hospitalizations or deaths much. But will it help to lessen the spread of COVID? Because one of the arguments that we're hearing a lot of is that kids who are vaccinated are less likely to spread COVID to their older loved ones.
Absolutely. So people that are adequately vaccinated are less likely to be infected with the virus, as well as less likely to spread. But you need to be adequately vaccinated. There's no country that is using a single dose of vaccine in a 12 to 17-year age group and expecting for that vaccine to protect against infection and protect against prevent them from transmitting the virus. So a single dose of vaccine in that age group simply hasn't been tested in terms of its public health value. That is its ability to actually reduce transmission of the virus. We also need to understand that the children that are going to come forward to be vaccinated, whose parents are going to allow them to be vaccinated essentially, are probably children in the same households where the adults have already been vaccinated, rather than in households where adults have not been vaccinated. So the main transmission that takes place from children to adults probably takes place in a household rather than outside of a household. So again, very likely to be any major significant benefit, and a single dose of the Pfizer vaccine, especially when dealing with a Delta variant, is probably not going to confer any good immunity in protection against infection or mild COVID. You would require at least 2 doses of the vaccine.
Professor, so it's clear that you're arguing it might be ineffectual to some extent, and it might also not be a priority because we've vaccinated so few of our older members of the population. But are there risks which parents who are watching this show tonight should be aware of before they see their kids, get into an Uber and go and get their vaccination? I mean, are there good reasons not to allow your kid to get vaccinated?
So with the Pfizer vaccine, the major concern is, especially in boys, in children, in males under the age of 25, in fact, where there's a risk of them developing mild inflammation of the heart muscle, otherwise known as myocarditis. Fortunately, that sort of side effect occurs roughly in about 10 out of every 100,000 people that are vaccinated in that age group. And it's usually a self-limiting illness. It usually disappears after 2 to 3 days. It's unknown whether it will have long-term sequelae, but there is this risk. But this risk for the Pfizer vaccine, at least, is especially in children, in males under the age of 25, and more so after the second dose of the vaccine, rather than after the first dose of the vaccine. Other than that particular risk in children, there isn't any other signals to be of concern currently. But again, it's something that if boys especially are being vaccinated in that age group, if they're experiencing chest pain, if they're experiencing a rapid heart rate, then they need to go in to be investigated to ensure that they have not developed a side effect, which is uncommon, as I mentioned, roughly 10 out of every 100,000 people.
Professor Shabir Madhi van Wits, baie dankie. Bly ingeskakel. Na die advertensies bekyk ons onafhanklike kandidaate op die platteland wat hul onderskeie munisipaliteite wil regruk.